Good morning, Monday morning, March 30th. Mondays with Matt. Today we're going to talk about healthcare. Starting in just a second. Just always like to say hello a little bit. Good morning. My name's Matt Ference, running for the Pennsylvania House of Representatives in District 6. Mondays with Matt, 9 o'clock on Monday mornings, to talk about some of the issues that we face here in northwestern Pennsylvania and across the Commonwealth of Pennsylvania. So we're going to get set up in the studio now. Always involves a quick look at the ceiling and then down into this. So I want to remind you before we start, just pull these off for a second. This is what we were looking at last week. And the first issue we're going to talk about here today is going to be healthcare, which is something that is on all of our minds right now. I'm just going to highlight that so we know that we've covered it. Obviously, we're facing, healthcare. We're facing a moment of a pretty significant public healthcare crisis with what's the reason why we're doing Monday with Matt online as well, because we're all sort of in quarantine or in social distancing so that we can be careful about not infecting one another with the coronavirus. And one of the things that we see with that is the implications or the consequences of not having widespread health care. I think that an overarching place to start is if we think about the present moment, we could think about how much less anxiety people might feel if they all knew that they had easy access to health care and all of that. But I want to talk a little bit more personally to start with. It's March 30th today. I'm going to write that down. That's an important day in my own life. So today is March 30th. And for the last 4 years, I've been celebrating that day as, I apologize for this, but it is what it is, as F.U. Tumor, You're Dead Day. Because in March of 2016, I actually, about now, was waiting to be hauled into an operating room to have brain surgery due to a tumor that was found in my skull. And I want to start with just a little image. I've got an eraser. I have this healthcare, and this is how I discovered that I had an issue. So I'm looking at the H. Let me get a pencil first here. I'm looking at the H of healthcare, and I'm just going to draw this circle to start with. And then let me use this eraser. This is actually what I see out of my left eye. As I erase here. There's a big old blind spot in my left eye. Because the situation that we face is, if we draw a little skull here, and this would be your nose, and your optic nerve comes back into your brain, and there's a tiny little hole right there where that optic nerve goes into the brain, and as it turned out, there was a tumor right there. And so as that tumor expanded, it created an abscence in that hole right there, absence in my vision, and that's actually how I discovered it. I was reading Calvin and Hobbes, as it turns out, every night to my now 11-year-old, and for a couple of years I was noticing that I could make Calvin's head disappear if I closed my right eye, and it was this blind spot that was developing. Ultimately, I'm going to draw something in this hole, and that's $150,000. That is the rack rate of the surgery, the hospitalization, and 6 weeks of radiation treatment in the summer of 2016. $150,000, if I hadn't had insurance, is what that would have cost, which I could not have afforded. What it also meant is that my own healthcare expenditures went up considerably because one of the things we experience is a high deductible health plan. And so every year, the first deductible before anything is covered for the family is $3,000. And every year I spend that $3,000 because of this hole in my vision, that I'm fine, everything's been treated, and everything's stable and it's been stable for the last 4 years, but I still have to have annual MRIs and checkups. So there's a $3,000 cost that I've incurred that I will never get away from. And so some other figures that I think we want to think about, and I don't want to talk just about money today, but it's one of the things we need to think about with healthcare, is that in addition to that $3,000 of deductible, after that the next $3,000 I pay at 10%, so it's the next $30,000 you're paying too. So some years we're over that. But I'm also paying about $350,000 a year. So that's the deductible. My total family cost for health care these days, every year, is about $7,000. $7,000, which is more than, use the little guy here, more than 10% of my pay goes to healthcare costs. More than 10% of my pay is what I am currently spending for healthcare. It's expensive. And that's actually, I'm not going to talk just about myself here today, but in some ways I think that's an important touchstone. In some ways that has been a lasting legacy of this absence. I want to kind of circle that. This absence in my vision. And you can't really forget about it because you're throwing money into that hole forever. So I want to think about, well, I'm going to put this down here for a second if you can see that. Single payer improved healthcare for all. So there's a website on there that's called healthcareforallpa.org. And this is an organization that in the Commonwealth of Pennsylvania has been talking about having healthcare as a single payer, and we need to think about what single payer means. Single payer basically means that Pennsylvania becomes not your doctor, but it becomes the insurer. So instead of paying for health insurance from a private company, tax money is being used for the Commonwealth of Pennsylvania to be the insurance company, and then they are reimbursing the private hospitals or public hospitals, whatever it might be. But an important, this is the same thing on the national level, an important thing to keep in mind is no one who's talking about single-payer healthcare is talking about what we would call a, quotes, socialized medicine in the evil tone, and that's the idea that the government owns the doctor's offices and owns the hospitals. That's not what single payer is. Single payer is the same system, but instead of using insurance companies, you use government. I actually think, I'm going to move this so I have some space. I think that it's likely very difficult for there to be a national single payer system without some significant buy-in from the states. And I actually think it's probably going to be a state-level solution. And I think in Pennsylvania we don't need to wait. And for a decade, this organization has been bringing forward legislation with sponsored bills in both the House and Senate that's never actually gotten to a vote. And what that means, this single payer is 3% of an employee, personal wages. So you would pay a tax of 3% of your wages. And so that's the person. And then 10% would be paid by the employer. So ultimately 13%. So I want to move over here for a second, and I want to start by thinking about the financial implications of this, because let me just jot this down here. Goals and obstacles. So if we look at this situation, this is the Ference family situation. Right now, if we moved to a 3%, that would be approximately $2,000 a year for me. And the 10% would be approximately, based on last taxes, $6,700 for my employer. And we're like, whoa, that's a big number, $6,700, $2,000. But the first thing you can see is if my total family cost, if we compare these, is $7,000 and moves down to $2,000, even though my taxes have gone up $2,000, I've saved $5,000. That's a pretty big deal. It gets better, actually. So right now, the current situation, so we know that I'm paying $7,000. My employer is paying, get ready for this number, $14,000. So that's a total of $21,000 for the high deductible insurance that we have. I'm paying $7,000 out of pocket, and the college is paying $14,000 for the family coverage. That's $21,000. If you look at these two together, you reduce the cost quite significantly down to $8,700. I don't know why I'm putting random commas in here this morning. $8,700 for my family coverage. So if you compare this number to this number, well, I'll let you compare which one of those is smaller. So the single payer system, which I should mention is actually expanded healthcare compared to what I have now. And I do have good insurance. It includes dental, it includes vision, which are not actually in my current healthcare package. Instead of paying $7,000, I'm paying $2,000. Instead of paying $14,000, my employer is paying $6,700. There's a total of $8,700. We actually probably should assume there that wages could very much go up because the expenses have gone down. Even if they give me half of the savings, that's an extra $3,650 a year. And so the net swing positive could be $8,650. So paying an extra $2,000 in taxes could yield $8,650 more in the family pocket per year. So this is why sometimes you'll hear certain politicians say, I'll never vote for a new tax or a tax increase. This is a tax increase that saves you money. It's important to think about how that might work. That's pretty significant. But then we also have to think about all of the different agencies that have significant healthcare costs. Consider Erie County and Crawford County. Consider the school districts. Consider townships in cities. All these have health costs that we would assume are going to experience similar positive effects, which means, hey, tax savings. Because if these institutions don't have to pay as much for health care, then they either can hold the line on taxes, reduce taxes, or have more money to do the things that they need to do. Suddenly, I start seeing health care as not just an answer, and I still want to get to this, to the most important thing, which is health care, but also starts to change one of the other big issues we had on the chart about Crawford County and Erie County, and that's poverty. First of all, people would be able to have health care, and that's the most important thing, but we also start to be able to lower the cost. So let's look at a couple other numbers before we talk about some other ethics things. So remember last time I was talking about median family income or household income. And we had $95,000 a year up in Fairview, and in Crawford County it was $49,000, and in Meadville it was $35.5. So what I want to think about is, what does 3% mean in each of these household situations, because that would be the cost for health care. So in Fairview, the cost of 3% of $95,000 is $2,800. In Crawford County, I'm sorry, there's a shadow there, $2,800. In Crawford County, the number equals about $1,470, and in Meadville, our number is $1,065. So, wow. Look at this Fairview number. median household income of $95,000, $2,800 is less than the deductible I'm currently paying of $3,000. It's less than the per month access fee of about $350 a month, so it's about $4,000 a year. For coverage for a family income much higher, a household income much higher than what I have, all I would ask, if we want to think about these financial issues, is compare what you are paying right now for your health insurance versus 3% of your income. And then understand that it's almost guaranteed that your employer is saving money if they're only putting 10% in. So that's a big deal. This is a game changer. So I want to hold off on obstacles here for a second. I want to talk about goals. Like, what do we need relative to healthcare? So I was talking to a friend of mine who is the director of a free clinic in North Carolina. And one of the important things, and I'll talk about this in a second, I keep saying that, but one of the important things she mentioned when we were discussing these issues is the high percentage of her patients who are single mothers. And that has a lot to do with the current system we have, which tethers your health care to a job. We'll get to that in a second. But she said, look, this is what we need. Doesn't matter how we get there. And I agree. I actually don't care how we get there. I think single payer is the best way. But our goals need to be health care for everyone. Oops. For everyone. Looks like Eeyore one. For everyone. It needs to be actually affordable. And it needs to be fully portable so that you're not running into out of network costs, or even if you're traveling. And so this is why I think that the single payer systems are the best way to do that, because they're for everyone, because the Commonwealth becomes the insurer. They're affordable. That's all the math I've been doing over here. And they're portable, again, because you have the force of the state. So what's the obstacles? One is perceived cost. People say, well, it's far too expensive. It's not. I'm just going to cross that out. There's a reason why we're the only major industrialized nation that doesn't have either single-payer health care or actually socialized medicine system, and it's not about cost. Actually, the efficiency of our healthcare system is quite poor. So that's one issue. Perceived obstacle is cost. We're going to cross that out. One of them has to do with choice and freedom. And I understand we all do want to be able to choose our doctors. There's nothing about this that necessarily restricts that. And if you're living in rural Pennsylvania or anywhere in rural America, I think the question of physician choice really should be central to your mind, because I know a lot of people who can't get a primary care physician because we have a shortage. I think we still have choice. And again, no one's telling you what doctor to go to. And then the other one has to do with wait times. I hear this a lot if you ever utter the word Canada, when you're talking about healthcare, people say, oh, but Canada, they have all these wait times, and so people just have to wait for their doctor. And if you actually talk to a Canadian about that, you find that is much less of an issue than you might imagine. I have a good friend up there who suffered cancer as well, and it was not long. He was in a very rural area. It was not long before he was getting treatment in a major center. So the wait times, we've got them too, in fact. So all of these, really, the obstacles we present aren't real. Okay, here's the other big one. Consumer choice. So I'm going to write consumer and this idea of competition. And so there's a story to this. When we moved to the high deductible plan, there was a company that works as the healthcare consultant. And they came in to talk to us about what this change would mean. And so the person presenting it told us a story about her daughter who was outside playing, this is an arm, and broke her arm. And as a parent, I would say, we'll put a little sleeve here, the first thing you want to do when your child is injured is get them taken care of. Well, what this person said is, and what I did immediately was I went to the computer, make it an all-in-one computer here, keyboard, and I started looking up what it would cost to have x-rays and treatment for a broken arm in the local hospital so I could become a, quote, informed consumer and save myself money. And I want to back up for a second if you didn't hear that. The idea of this is that a child has broken her arm and the next move is to go to the computer to find out where treatment is cheaper instead of going to get them treated. So ultimately, yes, there's a cast involved here, and that's good, so we get the treatment, but that the first move has to be to think about the cost. When people are talking about consumer and competition, the only way competition works in the consumer marketplace is that we need to be able to opt out, to not buy something. How do you opt out of health? And the answer to that really is that we become opted out depending on the insurance we have or the income we have. So this whole idea, I'm doing a lot of X's today, I find this abhorrent because healthcare is a human right. We all deserve to be healthy and we all need healthcare. If we have to compete, the thing we're using as leverage is our own health. So then we might say, why is it that we actually don't have this kind of healthcare? Why do we have employer-sponsored healthcare? Particularly if we think about it's costing us more, it's denying many Pennsylvanians healthcare, and it's costing employers more. And even as crucially, it's creating a stable, quote again, marketplace for employers. Because often healthcare cost increases are ratcheting up. Talk to anybody who is in the meetings for a company that's doing healthcare. Healthcare costs can go up 10% in a year. It's very hard to budget, and I'm quite sympathetic to people doing the budgets in these situations. I was on the finance committee at my employer when we had to think about these numbers. It's very hard to budget for these healthcare increases. We still actually have it tied to our employer. And it's all about control, in my opinion. The only reason I can see that some believe that we need to maintain an employer-sponsored healthcare is so you don't quit your job. I'll cite Canada again at great risk. I have a lot of friends in an area of Canada that has similar financial fortunes as here, and they lose their jobs, just like people lose their jobs around here. And that stinks. No one enjoys losing a job. But the one thing I've never heard anyone be worried about is their health care. No one is saying, well, I lost my job and I don't know how I'm going to be able to afford my insulin, or I don't know what I'll do if I break my arm, or I don't know how I'll get treatment if there's a global pandemic. It's not an issue. But because we yoke our health care to our jobs, you can't quit your job. You can't quit a bad relationship. So say you have an abusive partner, and that abusive partner has employer-sponsored health care and you don't. How hard is it for you to get out of that situation because you won't have health care, and you might not have health care for your children? That goes back to my friend who runs this free clinic down in North Carolina, and why such a high percentage of her patients are single mothers, because they've gotten divorces or they've left bad situations and they didn't have the health care. It was yoked to a partner's job. So we're being held into jobs we might not want. We're being held in relationships we might not actually be safe in, and you can't start your own business. I have never understood why, say, a party that is all about small businesses or talks about being all about small businesses isn't all over single-payer health care. Because if you have a small shop of some kind, one of your biggest outlays is going to be health care for yourself or your employees. If that was taken off the table of your budget, you would actually have the incentive. So this is not good, to understate it, in major ways. We actually increase our freedom, increase our ability to be creative, increase our liberty to be in relationships that are healthy for us if we don't have our healthcare yoking us to an employer. It's an antiquated system that doesn't make a lot of sense for the employers or for anyone else. And at the end of the day, the biggest reason to do it is because we all deserve to be healthy. So that's what I have to say about healthcare this morning. I'm Matt Ference. Put that down here. I'll draw my little sketch. As you may or may not have heard, it's now June 2nd. For the primary, it's been moved back in these days. I'm going to keep coming at you on these Monday mornings for Monday Mornings with Matt, give you an idea of my platform, think about how the stuff I'm talking about relates to what we can have in a healthier future for Northwestern Pennsylvania. Thanks for joining me this morning, and I'll look forward to seeing you next time. I'm going to take this up and say goodbye. Thanks for coming in. Be safe out there. Wash your hands. Keep staying home. It's an important thing to do. Hope you're healthy. I'll see you later.